Hey everybody, welcome back to The Pathway. My name is Taylor Henrik. I'm here with my colleague Sarang Patel.
Hey guys.
And today we're very, very grateful to be joined by Dr. Paul Fu. Dr. Fu is the Chief Clinical Officer at Bronson Health Systems. And today we're going to take a little bit of time to talk about, in the mental health field, in neurology, across the board in healthcare, what do we as prescribers or providers do to de-stress? It's very easy for us, I feel, to do as I say, not as I do.
Yeah.
And that's probably an example that Sarang and I live by. But if we're in a high state of stress and if we're constantly in crisis mode ourselves, what kind of care are we going to offer to our clients, right? And so I think it'd be kind of fun today to take a look behind the veil and share a little bit about how we de-stress. How do we balance incredibly high patient loads? How do we balance the stressors of trying to run a massive health system or a rapidly growing company? And what do we do to try to keep our fears, our stressors under control? Sound good?
Yeah.
All right. Lead us out, Sarang.
For me, the biggest thing has been, I'm not jacked or anything, but it's been the gym just from a standpoint of I don't have my phone with me. So I know we talk about with kids, talk about that stuff, put your phone away, keep tech as much as you can away at times. But that for me has been a big thing because it is early in the morning. Doesn't matter if the clinic's on fire, like I'm at the gym. I'll find out after because I don't have my phone with me, but it's in the locker or whatever it is, or in the car. So I think for me, it's that small piece of window where in time where I'm disconnected for a little bit. Obviously, if I need to be reached, I can be, but you're kind of stepped away for an hour, a couple times a week even, I think makes a big difference. And then once you get into the habit of doing that and you don't do that for like a week or two, you start to feel sluggish, lethargic. You kind of like notice a feeling of like you're going back to your old ways a little bit. And then it sucks because you have to spend that time to get back in that habit again. So for me, that's like my quick thing. It's just a normal thing right now, just an hour a day, if possible in the morning, to kind of step away. What about you?
Sure. So yours is exercise.
Yeah.
Safe to say. I have a couple, and not to steal any thunder here, but the first thing that de-stresses me, honest to goodness, is talking to you. I'll be honest. I feel very blessed to do this together.
Thanks, man.
Like I think I hear about a lot of people, our friends even, who have struck out on their own and done businesses. And the level of stress that I see them putting themselves through trying to do it alone is immense. So like whenever I'm feeling super stressed, I'm like, I almost inherently call Sarang. And it's like, whether we're both stressed to the max, but then it's, at least it's a shared mutual misery. So we're able to share in that together. It somehow makes me feel better. Like I feel like if I'm going it alone, I feel super stressed. And then I'm like, if we kind of like rationalize and talk through, I mean, it can feel like the world's ending sometimes with some of the stuff we go through.
Yeah.
But that's the first thing is like communication. Having open lines of communication with Sarang and then with Phil, our own COO, makes a massive difference. The other thing for me is just having an anchor. And I tell my clients all the time when their stress levels are high, like when you have multiple sources of stress, you got financial stress, family stress, health stress, all coming at you at once. As a human, your natural instinct is kind of to internalize and just like cloister, right? Your goal is like become an armadillo, shield yourself, and like try to get away from stress. So I tell them 30 minutes a day, you have to have an anchor. Okay. So your anchor can be mindless television, going for a walk, playing with puppies, going to the gym, whatever it might be.
Right.
So I try to live by that. I take 30 minutes a day where I either put my phone away and spend time with my daughter. I watch a dumb show. I put on sports, I play a game, whatever it might be. But I try to do it because I tell my clients so often, I'm like, look in the mirror, buddy. Like, you're not doing that. You need to do that. Why are you being so angry? Why are you being so feisty with people? Like, I can feel it. I'm tensed. I'm agitated. And I'm like, step back, regain perspective, take a moment and try to find your balance within your day and then get back after it. What about you, Dr. Fu?
I love this topic because I feel like the two of you are the experts on this. So I can just kind of sit there and say nod and say yes. I actually love the point that you brought up. I think one is the people that you work with make a tremendous amount of difference. I think early on in my career, I didn't really value put as enough of a value in terms of the teams that I'm working with. If you have a supportive team, if you have a supportive partner at home, if you have people at work that you feel like you trust and can go to and can kind of let the walls down a little bit, especially when there's difficult issues at work and in the healthcare environment, we're always dealing with difficult issues. I think that is a significant portion of de-stressing. And so being able to kind of have honest conversations with your colleagues, I think is very important. Similarly to Sarang, I actually try to exercise. So one of the things that you and I share is we used to be sprinters in high school, and especially when I was young, I absolutely hated long distance running. But nowadays, I actually find it kind of a nice solace. It's still as painful as ever, and my long distance running is really slow. So I can't get under 9-minute miles. But despite that, and despite the huffing and puffing, it's actually like kind of relaxing. And afterwards, I'm really glad I do that. In my work, a lot of the work is administrative, but now I've added back a little bit of clinical. And I do think that when you shift kind of mindsets, when you shift to kind of clinical care and then you have to go back to administrative, that usually helps with the stress a little bit. I just think back to my Friday, actually last week. So I had a half day of a clinic where I saw patients in the headache clinic. And then I had a half day of kind of actually full of interviews. So we're actually interviewing for 2 new directors. And so I was interviewing all the way until 5 p.m. And then immediately after 5 p.m., at 6 p.m., I'm the head coach of my 4-year-old daughter's soccer team. And so we had six kids out there, and trying to get them to do some drills and focus is always an interesting experience.
Impossible.
But then I end the day at 7:30. But I think about it, and it's the variety of different parts of my work. Actually, I feel like helps with, if I had gone and done all administrative all the way through until 7 p.m., that's very difficult. But the fact that I'm dealing with different problems is also helpful.
Absolutely. It kind of allowed you to start your weekend, shift your focus. You were able to have different portions of your day that you moved through and then ended it on a high note. Watching your daughter play soccer on a Friday night honestly sounds fun.
Yeah.
It's just, it's a joy. I can speak to this last Friday, interestingly enough, was kind of like a long day. Him and I kind of get hit with meetings and get roped in, and there's always, I just feel like every Friday there's a fire to put out. Like I just anticipate there's going to be something burning and we're going to have to throw some water on it no matter what.
Right.
So last Friday I had the opportunity, him and I have both gotten into, but I've gotten really into pickleball lately. And so, for the washed up athlete that I am, it's something I can do without injuring myself as often, still some. But I went and played for like 2.5 hours. And I got to tell you, I was on cloud 9. It was like cathartic. I just kept playing and playing and playing. I was drenched in sweat. I was like, it brought me back to like, we used to play basketball on a Friday night. Yeah. Like we used to just like go do athletic stuff, throw a ball around at each other's house for like hours outside in the dark. Like, and maybe it's just boys being boys or whatever it is. Anybody can do that. But the simplicity of it, I was just like playing and I'm like, I was so happy. It just felt good. And it wasn't about being away from family or being away from stress. It felt good to unwind and just burn off a bunch of steam and know that I was going to sleep good because I was exhausted. Sometimes it's that simple.
Yeah. I mean, come back to company, right? You need that company if you can.
Yeah.
So luckily we have obviously each other we can talk to, which is nice to de-stress about something. But I'm sure, on an admin level, when you have a large admin team, right, and you're taking care of like your path, right? Like for Taylor and I, it's kind of cool because we have our lanes that we manage, but it's kind of like us and obviously Dr. Amin too. So we'll cover each other pretty easily, or we have to do like the same topic. We'll both get on it together, which is kind of cool. Do you find that sometimes with the big institution, it's harder because, you are the CCO, you have like your massive lane that you have to manage that obviously I'm sure there's obviously those underneath you that you can obviously rely on as well than you need, but sometimes it does come down to you and you only that has to make the decision as far as what happens in that pathway. So sometimes it could be kind of lonely up there as well, right?
Yeah, I think in some contexts, but in my leadership style, I always try to get as much input as I can and get people involved. And kind of similar to you, as we've talked about, when you're going and hiring and starting a new clinic, you're looking at acquiring people that are kind of like-minded, that really want to deliver great care to the community, that are great people as well. And so if you are kind of putting in that work to hire the right person, that makes it a lot easier on the back end. And so you know that you have people that you can trust. And so you're not having to, when problems arise, you know that, hey, these people are individuals that I could rely on. And so like the fires, you're not just putting it out yourself, you're doing it as a team.
That's a great point. I do feel when I feel ultra confident about a new provider, a practice manager, an admin staff, or a support, like an ancillary staff member that we bring on, I do feel less stressed. When I know that they're cut from the same cloth or a similar cloth to us, and they don't have to be like exactly like us. They don't even have to have similar values or morals. But if I know that they're going to treat clients with the most possible respect, they know their stuff, and they're going to offer a high level of clinical care from a psychiatric standpoint, I do feel better. I do feel better knowing like, hey, I'm putting these clients that are trusting their care to us. They're coming to us voluntarily, and I'm putting them in good hands. That does relieve a ton of stress. Put everything else aside. It's like just boil it down to like, are they going to complete this appointment? Is it going to be a high quality for the client? Is the client going to walk away better than when they got there? And if the answer is yes, then that brings me a level of solace for sure. Put everything else aside. Put aside family stress or health related stress and just focus on work for a second. That helps. Makes a huge difference for me, because then I know that regardless of how well I do my job, they're going to do their job well.
Yeah. And I think the other piece about stress, especially for providers, is you do there's a lot of work that you do on a day-to-day basis that's thankless. And so one of our focuses has been recognizing great effort and really great care throughout Bronson. There's two things that I really have enjoyed working and setting up this year. One is actually, this is kind of a sports reference, but so you know when high school athletes or college athletes sign with their team, they do like a signing day. And so at Bronson, we actually unveiled a provider signing day. And so when physicians or APPs start, we do a whole event once a month where we ask the providers that are starting to bring their families and not only their families, but the clinical teams that they're going to be joining. So if they're in pediatrics, the pediatrics teams that they're going to be working with, they're in hospital medicine, the hospitalists will come together and they'll celebrate. And so we'll do kind of a faux signing. They're actually just signing a piece of paper with their name, but then they get like Bronson gear. They're with their families. They're taking pictures with balloons around them and kind of the Bronson logo in the back. And that's really great. In addition, we do an evening of excellence where we celebrate our physicians at APPs that reached a certain caliber of patient experience. And I think that's very important, is to recognize really hard work, because truly what we do and what you guys do on a day-to-day basis, some of the work is unthanked. And so being able to have kind of a model where you're recognizing the providers that are doing great work is important.
That's a genius idea.
Those are wonderful examples. Yeah.
That is sick. I might have to steal some of those. If you don't mind, just some ideas there.
As a provider, you can, I mean, I can just imagine the smiles that it brings to their face, and involving their families, like letting them be like, hey, look at how, like, I'm excited about this. This place really wants me here, and you can see it. You can feel it. That's very cool.
Yeah, and you kind of thought there's like a whole science about how do you make somebody feel like they belong. But you know, I think one of the studies I heard is actually one of the best things that you could do is buy them a jacket that has their name on it and with the company logo on the other side. And so with the provider signing day, that's something that we're hoping to do, is just make the providers feel like they belong. Not only that they themselves belong, but their family belongs, because as we recruit people to Southwest Michigan, you're not only recruiting them, you're recruiting their families.
Absolutely.
And also have their team come together and make them feel like, hey, look, this is actually an entire team that's coming together.
That's wonderful.
That's genius.
Yeah, then they feel engaged right off the bat. They're excited to meet their future colleagues. Their family's excited. Yeah, that's wonderful. That's wonderful. And I can imagine that makes them feel a part of the larger whole right off the bat. You're not just joining some ambiguous group or something, you know, Bronson's big and it's got 850 providers, but that's such a personal response for somebody to get. I can imagine that going into their first day, there's still going to be those, you know, anticipatory anxiety that anybody has, but they feel a whole heck of a lot better when they step foot on your grounds, knowing that they've already met all these people and they're supported. That's great. That's wonderful.
We've talked about it before, like some of our, it's not necessarily like a daily stress relief, but sometimes throughout the year, like we try to throw a crazy company holiday party is like a big thing that we do that is beyond the normal holiday party. And we want to do more of them, at least like 4 times a year. We've talked about even trying to get these together where you get to see us like outside of work. We joke around all the time anyways at work, but joke around even more, and really have a good time. I think that's something that our staff, office staff, billing team, providers have really recognized, and some people have been saying, hey, we want more of these as well, because they're like, we never get to see this. We never get to see the owners or other providers just be themselves without being super professional in email or whatever it may be, right? So I think, having the signing day thing would be kind of cool too to kind of throw in there as well. But it's interesting to see because you typically don't hear of big institutions doing something like that, which is really cool. I could see like a small, I've seen like dental clinics on like Instagram and TikTok, and they'll do like, oh, someone's been here for 20 years and they're getting paid, whether it's true or not, whatever it is. But you don't really get to see that with big institutions. That's really cool. Really, really cool.
Yeah. One of the fun things that they did with the health system in Massachusetts is we used to have a quarterly provider game night. And so I think there's a lot of nerds in the physician and APP field, but people love board games. And I think that's a very different context. So even if you are referring referring patients to each other and then even working together at a hospital, the context of playing a board game together is very different. And sometimes actually you see people in a different light too. Some people are very relaxed when they're playing board games, and some people are very competitive. I remember I saw one board game that was like, I was a little scared. I was like, is everybody okay here? But being able to like recognize each other and be like, hey, we work together, but also we can play together. It's a different environment.
That's a good idea.
It's fun to introduce people into those different environments. Even Sarang and I took our practice management team out for a dinner this summer, and it was just nice. It was so nice seeing everybody out on a patio just enjoying themselves. Just a non work related environment. It's just fun to let people express themselves and allow people just to be themselves around us and not feel any type of way.
What are some super unique, whether they're personal or not, coping skills you guys use or stress relief things that you guys do? So I'll give you my example. It's not adult coloring, but like scratch cards. I used to be a scratch card guy. I love that stuff. But they have these like picture scratch cards that they're supposed to help with like anxiety. So like when shit hits the fan and you're not sure what to do, and obviously we talk to each other later on, there's like this huge page. It's like a fine tool. It's kind of like artsy a little bit, but you'll scratch minute areas, small detailed areas of a massive picture. And you'll kind of get the color behind all that kind of stuff. So although it's like mind numbing a little bit, but it kind of helps me at that point to kind of just be like, all right, I'm just checking out for a little bit to kind of do this. What are some super unique things, or do you have any unique things that you guys do?
Mine aren't super unique. Mine is I have a mindless game I like to play on my iPad.
I'm about to say I always see it in that game.
Yeah, it relaxes me. It brings small moments throughout the day. I play it, and it just, I don't know. It's become a part of my day to day in terms of I take a little bit of time and do it, and it's fun.
How many years have you been playing this game?
I enjoy it. Since before my daughter was born, I've been playing it. So over 2.5 years.
On your phone game.
Yeah.
Which is a long time for a phone game.
Yeah. I mean, it's really held my interest, and it's definitely something I enjoy. I don't know. It's just something that brings it to me. And then for me, it is running. It's still always going to be running. That's not uber unique, but it just relaxes me. Like you said, every time I leave the gym, I feel better. I don't ever regret getting those workouts in. That's not unique for me, but that is something that I'll always go back to.
Yeah, I think I do a couple of small things. One I would say is every time I feel anxious, I'll kind of stop what I'm doing and try to take 3 deep breaths, and that usually helps. So actually, I tend to find that you're able to do 3 deep breaths no matter what you're doing. Even if you're up on stage doing a speech, within this, you can kind of stop, hold for a little bit and take 3 deep breaths, and that always helps. I also think visualization helps a lot. And so if you kind of picture what you're doing, what's about to cause you anxiety, and then picture yourself succeeding in that really helps. And the last thing I try to do is just remind myself that I've prepared enough. I think all of us here are perfectionists, and there's always when you're about to do something that you are a little bit anxious about, there's a thought that maybe I didn't do enough to prepare. But then if I just remind myself, hey, I've done enough, I'm ready for this, that usually helps.
Outside of, I appreciate that, Dr. Fu. Outside of that, as we kind of round out this topic, if you could each offer, and I'll do the same, if we could all offer one bit of advice for somebody who is experiencing just a high level of stress. Let's not even call it anxiety. Let's not call it a mental health disorder, but those individuals who you can just it's palpable. You can feel the stress kind of emanating off of them. What would you offer them as a recommendation? What could they do? What's worked for you? And just something like that.
So I'll start off. So I'm probably the worst at this, probably a hypocrite at this, but because you can probably say I don't do this, but I would say that you said being a perfectionist is one big thing for sure too. So I think a lot of us have anxiety and we feel like, and even with patients, you say, well, you're anxious about a situation, you're stressed about it. You shouldn't be feeling like that. Like, how do I get this to go away? I think I just tell people like, it's totally normal. And in fact, like you should be stressed. Like it's okay to be stressed. This is a stressful situation. Someone passed away, you lost a job, whatever it is. It's okay to be stressed. Like anxiety is there for a particular reason. Obviously, if there's outliers, you want to try to use coping skills to get it together. But sometimes if you just say it's okay to feel stressed in this moment, take the time, take a step back, like you said, maybe visualize it a little bit where you got there. Sometimes you don't obviously plan to be in the situation. But if you can just take a step back and say like, yeah, I'm in a situation, I'm grieving X, Y, and Z, I'm very stressed, but it's okay to be stressed. Let that kind of sit there for a little bit and then try to work to tackle it. Sometimes I feel like myself in particular, something happens at the clinic, something's happened with Medicare changes, with Medicaid changes, and I'm calling Taylor the first thing and I'm saying, how are we going to solve this today? What are we doing right now? And sometimes he just says, like, let's just sit for a little bit. Let's talk about it in the evening today. Let's take a couple hours, think about ideas, and come back together. And sometimes that's okay. So then I have to realize, yeah, like right now we should be stressed, but it's okay. Let's kind of like tackle it together. Let's think about it and then reassess it.
Mm-hmm. Absolutely.
Yeah, I think Sarang said it really well. I think just recognizing that it's okay to be stressed. Sometimes I find myself like I get anxious about being anxious. So it's like meta anxiety. But the just even recognizing, hey, that it's okay to be anxious. And, you know, I wouldn't be upset at myself if I was sweaty on a hot day, or I wouldn't be upset at myself if I started shivering on a cold day. I think that pieces of it, you know, if I'm not upset at the anxiety and just recognize, hey, this is just a part of a body response, and just, you know, all those body responses pass, and letting that pass, recognizing it and just letting it pass, I think that's helpful.
No, I appreciate that. The last thing I would say is one line that I use commonly with my clients when I can see the stress levels really high is give yourself a little grace. Be forgiving of yourself. It's just understanding that their stressors are high. And I try to empathize with them and explain anybody going through the situation you're in would feel some anxiety, some stress. It doesn't help that you have an underlying condition. That's what makes it worse. So here's what I want you to do. Forgive yourself, give yourself a little bit of grace, and practice some self-confidence. Know that this is going to pass. Whatever your current challenge is, it's going to get better. It's not going to always be as bad as it is at this moment, but we're going to work together and we're going to get through it together. I'm here to support you, and hopefully you have other supports in place. So hopefully some of these things that we've shared, some of these de-stressing tips, a little look behind the veil for 3 providers in relatively stressful positions. But that's where we went on the pathway today. And I appreciate both of you sharing some of your things that you guys like to do. And I hope that this was helpful for some of our listeners.